Hey, what's up, everybody? Jaquel Wimbush here, your host of Back to the Basics of Health and Wellness Podcast. On today's episode, I'll be talking to Dr. Shyron Alston, and we will be talking about childhood obesity. Let's get into it. Childhood obesity is best tackled at home through improved parental involvement, increased physical exercise, better diet, and restraint from eating. Bob Filner.
Daddy, it's time to start your podcast.
Hey, Dr. Shyron, how you doing today?
Hey, Jaquel, thank you so much for having me. I'm doing well, thank you. How's it going?
Everything is great. Everything is great. Welcome to Back to the Basics of Health and Wellness Podcast, where we go back to the basics of health and wellness and figure things out and make things clear for the general public. So let's get right into it. So, what do you specialize in as a naturopathic doctor?
Yes, so my area of expertise includes managing autism and other developmental disorders. I also work a lot with thyroid disorders and nutrition. So I do a lot of weight loss and weight management in my practice.
Okay.
So those are my three areas of primary clinical focus.
Okay, nice. And I've been paying attention to your Facebook for the last couple of days, and you've been putting on some childhood obesity clinics and giving out some information about childhood obesity. What, I guess, raised that flag for you?
Yeah, so I see a lot of my practice is about 50% pediatric. So I see a lot of kids, and I actually have a subset who are obese.
Oh.
And so September is actually Childhood Obesity Awareness Month, and I am really passionate about nutrition. So in addition to my naturopathic medical degree, I also have a dedicated master's degree in human nutrition.
Okay.
So I know the power of food, and I know the power, when people have the right food to put into their body, how transformative that can be.
Mm-hmm.
And so I see a lot of trends with my patients, about how they're eating, the types of foods they're eating, when they're eating. And as we all know, childhood obesity is an epidemic. So
Yes.
we need to get this thing under control and get it under control quickly. And we have the means to do it.
Mm-hmm.
A lot of it is going to be educating our patients and
Yes.
clients to make better choices and coaching them through the process, because it is difficult when it comes to food
Mm-hmm.
and changing behaviors. It's very difficult for some individuals. And so that's why there are folks like myself, like you, doing the coaching to help get people where they want to be as far as their health is concerned. So childhood obesity is something that I feel we need to take back the reins and give our kids a better health outlook. One of the things I feel people don't understand or maybe necessarily think about long term is, what's going to happen to these children if they
Yes.
are living this childhood of obesity. What's going to happen when they become a young adult, when
Absolutely.
they become older? Are those things going to stick with them? Are they going to change? Those are all questions that need to be asked and need to be really examined in order to move the conversation forward and to get these individuals the help that they need.
Yes, because I noticed some things when it comes to like the child, the kid athletes out here nowadays, especially like when it comes to football and a lot of these coaches want to bulk these kids up at an early age because they want them to be big on the field, they want them to be strong on the field. Is that necessarily safe for a child to like bulk up in months to perform an activity on a football field?
Yeah, I think it depends on, what the ultimate goals are.
Mm-hmm.
Are they doing it? Are they doing it healthily? Because you can have, and we all know there is something called exercise medicine, exercise sports. There is a sub concentration of this. So you just need to make sure that the children, if they're going to go through these regimens of bulking up, that they are having somebody who's guiding and leading them through, like what's their macro balance intake? What are they doing consistently? What needs to be done to keep them on a certain platform or a certain performance level?
Okay.
So all of these athletes, so to speak, whether they're kind of doing it hardcore in the little leagues, moving into high school, transitioning into college and into the pros,
Mm-hmm.
all of these if you look at those professional sports teams, they have people who are taking them through the process. So it's not just a matter of bulking up.
Yes.
And interesting that you asked me those questions. I actually read an article, I think it was yesterday or the day before, where they were saying, if we're looking at strictly assessing the BMI, which is the body mass index, and we'll probably talk about that a little bit later, of professional athletes and athletes in general, most of them would fail.
Yes.
And why is that? Well, because if we understand what body mass index is, it's the amount of weight that you're carrying, essentially like the amount of mass that is affecting your body weight. So we've all seen those linebackers and those, linemen who are, 6 foot, 200, 250 pounds, 300 pounds. Are they healthy and active? I think that is a question of, we have to look a little bit deeper at within their metabolic history, as opposed to just looking at their weight in general.
Yes.
But going back specifically to the young athletes, to answer your question, I think one has to have a good team on board. So it's not enough to just bulk them up and just leave them be. Because what are the expectations? Yes, they might want to move forward with their career, might want to have a professional career or a collegiate career with a particular sport, but we have to think long term. What happens if those kids don't make it?
Yes.
And
yes.
now they have, maybe this excess weight, so they were training to be a linebacker, but they don't make the team. They don't make the cut. What happens to their self-esteem?
Exactly.
What happens, with their mood, with their attitude, and how is that going to impact their day-to-day activity, their day-to-day, coping mechanisms with, hey, I had this expectation and now it's not a reality for me. What do I do? So I think those are some of the things that we have to look for long term, like, self-esteem issues, worth issues, bullying, things like that.
Yes. Yeah. Because, without a stable, mental, then, you could be at risk for a lot of those things like the bullying and things like that. What is like I know a lot of people might know, but from your perspective, what is obesity?
Yeah, so obesity is the simplest way I could define it is it's assessing your body mass index, and that mass, so to speak, the mass is just substance. So we're looking kind of at the distribution of mass and how that affects the body weight. So usually the body mass index is an assessment of the height, but it depends. So it depends on your weight, the age, and of your sex. So whether you're male or female. And so based on those numbers, you come out on a scale. And when it's defined as obese, that means your body mass index is over 30. 25 to 30 is actually considered overweight. And so, again, a lot of individuals worldwide fall into that 25 to 30 range of overweight, and more even into that over 30 BMI, which is technically obesity. So that can create a lot of problems. And some people might say, well, obesity, it's just a familial issue. It's just a family history issue. There's nothing that you can do about it. My child is big bones, this and that. But obesity is preventable.
Yes.
It's preventable and it is reversible. So it is what I consider a lifestyle type of disease. But you need to be looking at, okay, what is the core? What is the underlying factor that's driving this obesity? So
Yes.
whether it's the mental emotional component, whether there are other metabolic issues, whether there are environmental issues, these things are things that need to be assessed. And most oftenly, what I've seen from patients who come into my practice who are struggling with their weight, whether pediatrics or adults, it's usually the same thing. They've been to other doctors, and their doctors just tell them, okay, they just need to stop eating a lot.
Yeah.
Well, I don't think that's really fair, because for some people who are actually obese and overweight, some of them don't even actually eat that much. So again, that goes back to what is driving their body to retain this excess fat. It's not just always about having excess of calories.
Yes. Yeah. And I guess getting to the underlying factors and issues could bring that type of information out. Because, when we see, I guess it comes to the parents as well, in the education and as far as with the sports teams, because when, practice is over and they're done with the calisthenics and they're done with the drills and things like that, sometimes it's late and the parents take them straight to the fast food place to get something to eat for the meal for tonight, for the night. And, that should be changed, and the information and the education should be available for the parents after they come off the practice field to say, hey, this is what you have to eat. These are the vegetables or the proteins that you are missing, and this can help you in the long run, after football, during football, and things of that nature. Correct?
Oh yeah, absolutely. And that, I'm glad that you touched on that. That's a huge thing. The fast food, yes, we want some calories. We want to get, they want to replenish, so to speak, but what are you actually feeding your body?
Mm-hmm.
Are you feeding it junk or are you feeding it fuel? Because if you're feeding it the right things, performance is going to be better, mental acuity is going to be better, stamina is going to be better, all those things. And I do understand, and that's, with a subset of my patients, that's one of the things that I get kind of a little bit of kickback on, or a little bit of resistance is, if my child, is hungry or they're participating in this, yes, it's easier to just go grab, a burger from the drive-through as
Mm-hmm.
opposed to going home, getting home late and cooking something.
Yes.
And another thing that comes up frequently is, it's economically, it's easier.
Mm-hmm.
I can buy my kid a whole meal for $5, $6, but if I were to go to the same, fast food restaurant, even to get a salad or a healthy meal, I'm going to spend at least twice that. So for kind of less filling, so to speak, I've heard mentioned to me, food. So there is a little bit of a mindset shift that has to be changed, because it's not always about, just the convenience. We have to think about the health. And our cells are really resilient. They know what to do when we give it the right nutrients, the right support.
Absolutely.
However, that takes, as you said, it takes education, and it takes getting people the right information and the right resources to help guide that process.
Mm-hmm. And I like what you said about the fuel. Can you explain what you mean by fuel? Fuel in the body for
Oh,
everyone.
yeah. Absolutely. So the way I kind of explain to my patients, I kind of use the analogy as a car, right? So if you have a decent car, you're not gonna put crap gas in it, right?
Mm-hmm.
Because if you put crap gas or gas that is not intended for your specific car, the specific make and model, then you're gonna have problems with it. It's not gonna run as it should, as efficiently as it should. And it's the same thing with our bodies. So our bodies we rely solely for fuel on our macronutrients. So we have macronutrients, we have micronutrients. Macronutrients, essentially, macro means big. So we have nutrients that are required in larger amounts that we need to sustain our health. And then we have micronutrients. Those micronutrients, again, usually required in smaller amounts, but we still need them. So macronutrients, and these are our main sources of fuel. So these are our proteins, our carbohydrates, and our fats. And there are different types of all of these three main macronutrients, and they have to be well balanced. So when we're talking specifically about, sports and sports training, yeah, there might be more protein, there might be more carbs, but you need to definitely have fat in there. You need to have a balance with everything. And so there's no one size fits all diet per se,
Mm-hmm.
or menu plan or eating style. It really depends on what the health of the individual is and what are they trying to attain.
Absolutely.
So that's the macronutrients. And then micronutrients, again, things that are just needed in smaller amounts. So these are all of our vitamins, our minerals, our antioxidants.
Mm-hmm.
So when we talk about, having things in balance, everything as far as what we're putting into our mouth, what we're consuming, has to be well balanced. And again, health is it's on a continuum.
Mm-hmm.
Our requirements today are never going to be our requirements for tomorrow.
Absolutely.
But we just need to make sure, okay, what is our goal? We need to ask ourselves, what is the goal for my child at this point in time? What is he or she struggling with or need more help and support with? And what do they want to do? So are they participating in sports? Are they doing other activities? How can we compensate their diet to make sure that we're getting them a balanced diet and nutrition?
Wow. Beautifully said. Beautifully said. Um, And I guess what would be like is are there any like signs to to obesity? Like what are the telltale signs that like you're going into that, I guess, because we have weight gain, but what are the signs
Hmm.
where it says that we're going into the obesity stage?
Um, so one of the things I generally look at is family history.
Hmm.
So especially, it's a little bit harder if I'm doing like, obviously a consult over the phone, but if I'm doing an in-office intake, and I see a family that comes in and they all have weight issues. That's one thing I'm looking at. So a familial kind of family history, that's one thing. So when we think about that, we usually think about genes. However, just because we may have certain genes that may be indicative towards obesity does not mean that that needs to be our fate. So we have the ability to change how our genes respond depending on how we're, what we're providing to our bodies and what we're exposed to, our lifestyle factors.
Okay.
So that's one thing. The second thing I see quite frequently, and I usually see it starting really early, about 7, 8 years old in my practice, snoring. When the parents come
Okay.
in and say, "Oh my
Okay.
goodness, like my child is like bringing down the house, snoring," and it's like, okay, well, is it? You have to kind of assess. Is it like an adenoid problem, which
Hmm.
some younger kids can generally have, and once the adenoids are removed, generally the snoring stops.
Yeah, that was my son.
If that is not the cause, sometimes it is a matter of, okay, are they having too much mass or too much fat, so to speak, kind of occluding certain areas, causing them to snore during the night when they're lying. So that's one thing, another thing I usually look at. Other thing is clothes. How are their clothes fitting?
Hmm.
So, are the parents needing to buy clothes at a rapid, kids, they grow pretty quickly, but
Hmm.
is it seemingly excessive? Like, they're buying outfits 1 month and then the next month the child has kind of outgrown it.
Wow.
Or things are, sweatpants that used to fit nice and firmly are now a little bit snug,
Okay.
so to speak.
Okay.
And then finally, one of the main telltales I try to assess from the patient, but also from the parents, is what is their child's mood like been
Hmm.
in general. So, do they tend when they get emotional? Are they tending to go to the refrigerator or to the cabinets and seeking out food as a comfort?
Okay.
Are they withdrawing and doing the same thing? Is there something that's bothering them that they're kind of just withdrawal? They stay in the house, they're not doing anything, they're not active. They spend a lot of time on their phone or on their video games, on their computer, just not really interacting much, but, using, again, in a different way, using that food as a comfort.
Hmm. Okay. What about like visual signs, like sometimes I see kids with like black rings around their eyes, or their neck could be discolored a little bit, it could be darker than the rest of their skin. Are those any signs of obesity, or are those other signs of other things that may be going on in the body?
Yeah, so definitely the eyes, the circles under the eyes, that could be a few different things that might be going on, not necessarily related to the obesity itself.
Okay.
The rings, some of the darkened rings around like the neck or under the underarms and the creases,
Hmm.
that might be more indicative of some type of metabolic syndrome, again, which goes hand in hand with obesity. So
Yes.
that is right there. Sometimes people will say, oh, I have this, it's kind of like leather skin
Hmm.
around their neck, or there's this dirty, I don't want to call it dirt per se, but that's
Yeah,
how sometimes patients describe it. Like, I scrub and scrub and I can't get
it's
rid of
like a
it on my
ring.
child's neck
Yeah.
or under their underarm. That is, technically a medical issue, and usually more along the lines of metabolic syndrome.
Okay.
So definitely at that point in time should be assessing, okay, what is the child's blood sugar, what's going on with their insulin levels, their thyroid hormone, and other chemicals within their body.
Okay. Do you practice I guess telemedicine or telehealth at your office?
Yes, I do provide telehealth consults. So I'm licensed in the state of Connecticut.
Okay.
So I see and accept insurance in Connecticut. Outside of Connecticut, it's telehealth consults.
Okay. All right.
So I do advise that patients have a doctor or a team of healthcare providers that they are working with, but we can definitely do naturopathic assessments outside of the state of Connecticut.
All right, guys, you hear that? So Dr. Shyron, she could definitely help you, even though if you're not in Connecticut, and if you are in Connecticut, she can definitely help you as well with your children and getting them healthy and back back to normal and things like that, and having them in those gauges where they need to be as children. So let's go back to let's go, I guess, in rewind. What, I guess, got you into being or how did you become a doctor, or what made you become a doctor?
Yeah, that's a great question. I've been asked this question frequently as of late, but I don't think there's any one answer. I kind of
Yeah.
always knew from like fourth grade that
Oh
I
wow.
specifically wanted to be a pediatrician.
Okay.
And over the years, like I've done programs, I did research education programs, and I've had certain experiences where I've got to see different types of medicine. So at one point in time, I was doing a research education program at Yale, and so part of my job was actually to shadow in the pediatric ER.
Hmm.
So I did that for a year, and it was really interesting. But I'm like, okay, that's not really the life I want for myself. So, then it kind of transitioned. Once I took 2 years in between my undergraduate and my graduate or my naturopathic medical school. Actually, 5 years I took, or 4 years.
Hmm.
But after I graduated from my undergraduate, I actually did 2 years of a research education program. And again, that was at Yale. So the first year I was in the lab itself, and then I worked in the ER. But I got more interested from my experience working in the Department of Psychiatry with behavior.
Okay.
And that kind of prompted me to, after that whole experience, start seeking out opportunities to work with individuals with autism and other developmental disabilities, because I was so fascinated with behavior. But that was the part of the lab that I did not get to participate in, but I just found it extremely fascinating. So fast forward, I was actually intending to enroll in a school in New York
Hmm.
for medical school, and we had some outpatient rotations that we needed to do. And our attending physician, the day we did the rotations, there was a patient who had type 2 diabetic. He was a type 2 diabetic patient, and the attending shared with him the news based on his wound. So he had a wound that he did not know was there, and it got necrosed to the point that they needed to amputate. And the attending had to share that information with the patient. And I just kind of had an epiphany at that moment, like, okay, why is surgery always like the last option? Why can't we be thinking, what do we need to do with our bodies before we get to this point? So from there, I did not actually end up matriculating into that medical school, and I started seeking out, okay, where can I find information about alternative medicine and natural medicine?
Okay.
And I ended up attending a forum in New York City
Hmm.
where I actually met some of my future professors from the College of Naturopathic Medicine and
Okay.
some of my future colleagues, and didn't even know the profession of naturopathic medicine existed, but gave me some information. I ended up going to an open house at the University of Bridgeport College of Naturopathic Medicine, where I graduated from, enrolled, and here I am, like literally 8 years later.
Beautiful, beautiful, beautiful. Thank you, thank you, thank you for that. And I like to ask that question to the doctors that come on the show, because I have a lot of kids and teenagers that listen to the show, and I want to open their minds up to maybe pursuing to become a doctor, or a naturopathic physician and things like that. So that's why I like to ask that question, just to get it out there for the people that's listening, and maybe somebody you can change a child's mind just by listening to your story on why you became a doctor. So thank you for
Yeah,
that.
absolutely.
Yep, yep. How can this obesity epidemic be prevented at this time right now?
Yeah, I think it's going to take a lot of education.
Hmm.
So, and when I mean education, we have a lot of information available to us.
Hmm.
Sometimes the information is presented clearly, sometimes not so clearly.
Yes.
But for all the information we have, there's also a lot of misinformation. So I think the huge thing is going to be education. The education component is first and foremost. Secondly, people have to understand and realize what their lifestyle is, and they have to take a critical assessment of that. So, again, going back to the healthy diet, that is one thing. Diet is everything. And
Hmm.
I will tell you, diet actually has more weight as it relates to your health and wealth and weight and things like that than actually exercise. So, I know some people are really, really into exercising and doing a lot, but it's really about 80% diet, 20% exercise. So that doesn't mean that you should not exercise and move, but it just means and shows you how important the diet is for foundational health.
Okay.
And again, it goes beyond excess calories or managing caloric intake. It's not just, okay, he or she is eating too many calories, just cut down the calories they're eating. It's more complicated than that.
Okay.
Healthy diet is the second thing. Movement, I've talked about. The other thing, knowing the susceptibilities. Okay, what are the genetics involved? What is the physiology, the biochemistry of the body at that point in time? Environmental exposures. I have patients who test positive for heavy metals, which can impede their body's ability to lose weight and can pluck up, certain nutrients in their bodies, and using them for one thing, so they're not bioavailable for other reactions in the body. And just to know their risk factors, think about what's going to happen if there is a diagnosis of obesity 5-10 years out. If you're not doing anything to change it, what's going to happen? What's going to be the risk? So we know there's mental health, anxiety, depression, metabolic issues, cardiovascular issues, endocrine issues. So the list is it's quite long and extensive, and I want people to really be mindful of that, because it's really important. We have the ability to change. I know it's hard to do sometimes. It's difficult, but that's why, again, guys, you have people like Coach Jaquel who's there to carry you through the process. You don't have to do it alone. It gets frustrating. It gets challenging. And sometimes you want to give up. You don't want to do it. But trust me, there is a light that's to be seen at the end of it. And it is a process, and it's always going to be a process. But I want my patients, and I want, the collective society to be healthy, because when we're healthy, we're productive, we're able to get things done. Cool. And that's just the basic of life.
Yes, it is. Yes, it is. Yes, it is. You got to take the time, and you got to have that accountability, coaching. You got to be held accountable to make the changes in life, through every aspect of life, from school to weight loss to working out in the gym. You got to have that accountability on you. So excellent, excellent, excellent. And what are last question? What are, I'll say, 2 tips or 3 tips that you can give out right now to help a parent right now that has a child that is obese and that they're struggling to help, get the weight off of them and feel better?
Yes. Tip number 1, get rid of all those juices and sodas. Get water. Water, water, water. It is unbelievable how many of people are walking around dehydrated, whether they realize it or not. That is huge. Water has many different functions in the body. You need to be adequately hydrated in order to make sure the cells and the nutrients are doing what they need to do within the cells.
Yeah, I tell my clients to carry a gallon of water with them on a daily basis just to get the water in.
Yeah, I mean, that's the thing. Sometimes for some people, it's out of sight, out of mind. And I have to remind myself, too, as a doctor, going in between patients every day. Sometimes I'm like, at the end of the day, like, oh my gosh, I only drunk like one bottle of water or 1 cup of water. But, I personally, I put, a notification. I have a notification that comes up on my computer, on my phone, every hour. Drink water. So sometimes it's just a constant reminder that you have to put to yourself.
Yep.
And that's okay, because it gives you a little bit of accountability, but it makes it so that you're getting into a habit. And that's what we want. We want our kids to get into healthy habits as they're moving forward, because if they're making these changes now when they're younger, it's going to be very easy when they're adults. Beautiful. I think about patients who I have who are in their 70s, 80s, 90s, like they don't want to change anything. It's like, I've been doing this my whole life, and it's a lot harder at that point in time to change than it is, right now when they're young. Yep. So definitely make sure that they are adequately hydrated. Buy them a water bottle that they can take with them and keep it moving.
Cool.
The second thing, and it's going to have to deal with a little bit of family planning, but, to start, try to do 2 healthy meals a week. And healthy, again, we go back to that, making sure you have a carbohydrate, making sure you have a protein, making sure you have a healthy fat. And when I mean carbohydrate, there are different types of carbohydrates. This could be another complete lecture, but, carbohydrates, doesn't necessarily have to be macaroni and cheese and pasta or rice. It could be other things.
Absolutely.
Think about complex carbs, things
Mm-hmm.
like beans, whole grains. Even swapping things out. So instead of doing a regular pasta, try a brown rice pasta, try a chickpea pasta, try something different to get the palate used to different tastes.
Absolutely. Good stuff. Good stuff.
And then number 3, the third tip, making sure your child is sleeping enough.
Mm-hmm.
So if you have control of your child's electronics, cut them off at a certain time so that they don't have
Hit that screen
access
time.
to them.
Yep.
Oh, yeah, the screen time, cut it down,
Yep.
especially before bed. Because, again, if they're not sleeping well, if they're not getting adequate rest, that can actually lead to making poorer food choices.
Yes.
So they need to be sleeping well. So whether that means, blocking off certain apps or certain things on their smartphones and tablets, computers, or completely shutting down the house at nighttime, shutting down the Wi-Fi and the internet connection, it can be done. It's hard, but it can be done.
Wow. Fantastic. Fantastic. Thank you, Dr. Alston, for coming on the show today. I really, really appreciate it. And I know my listeners appreciate the messages and the information that you gave out. How can everyone get in contact with you?
Yes. Well, I want to first thank you, Dr. Coach Dickwell, for joining on. Dr. Honorary Doctor, right?
Yes.
For allowing me to come on today. But yes, listeners can get in contact with you. You can call. My practice is Be Balanced Naturopathic Care Center. I'm located in Norwalk, Connecticut. So my website is www.bebalance.naturopathic.com. You can give us a call at 203-900-4886. And feel free to follow us on Instagram and Facebook at BeBalancedND.
Sounds great. And guys, you already know I'm going to have it in the show notes. So, Dr. Alston, I definitely would like to have you on again because I know you deal with autism, and I know a lot of listeners either know someone with autism or have a child with autism. So I think that would be a great interview or something for us to talk about later on down the line. So I will definitely be reaching out to you again to come on the show to talk about autism. But thank you again for coming on. I appreciate it. Excellent conversation, and let's do it again.
Awesome. Thanks so much, Nicole. I appreciate it. And yeah, let's do it. I'm all for it.
All right. We'll talk soon, okay?
Okay. Take care. Bye-bye.
All right. Hey guys, I would like to thank you all for tuning in to today's episode of Back to the Basics of Health and Wellness Podcast with my guest, Dr. Shyron Alston, when we talked about, childhood obesity, man, and just getting it under control and really, taking it serious as far as parents, and what you're feeding your kids throughout the day and at night for dinner time. So guys, if you have any questions or concerns, please give me a call at 201-888-4706. And as always, enjoy, be well, and continue to make the lifestyle change that lasts. Have a great one, everybody.